Welcome back. My next guest is Miss Lora Jody, who is a dietitian with advanced nutrition therapy. I get all that right?
Yes.
All right,
absolutely.
So dietitian, we all think about dietitians to help us lose weight, but you're a little bit more than that. So tell me what a dietitian is and how you actually get to be a dietitian.
Well, dietitians, we are nutrition professionals that we actually assess, diagnose, and treat anyone with a nutrition-related disease process or condition. We actually see people that are healthy as well, just to kind of help them maintain their fitness levels. Maybe they're in a sport, and we help with sports nutrition type of things. And as far as how to become a dietitian, it's well, we have a bachelor's degree. We go to school and we go to college for 4 years, and we get a degree in nutrition. And then after that, we typically do either an internship program or a master's program. Sometimes it's a combination of the two. So it's a pretty long process. It usually takes somewhere between 5 and 6 years to become a registered dietitian.
And in that process, you learn more about than just weight loss.
Yes, absolutely, yeah.
So tell me some things that patients would come to see you that you'd help them with.
Well, we see a lot of different types of patients, but in general, you know, some of the most common ones, of course, for weight loss, that's one of the big ones, but we see a lot of diabetes, a lot of people that have chronic kidney disease, GI problems like IBS, celiac disease. We see people with eating disorder problems. So it can really, the list goes on and on. We see anyone, like I said, with any type of nutrition-related problem. And most chronic diseases are somehow connected to nutrition, we find.
So you help them with meal planning?
We help with meal planning. So we do some counseling, and sometimes we'll provide them with a plan. We help them kind of determine what works best for them. So we develop a plan based on very individualized needs. So we go through their medical history. We actually look at lab work, medications. We look at their environment that they live in, even things like their schedules at work, their sleep cycle. A lot of those things can contribute to nutritional problems.
All right, now, we can't get away from losing weight because that's a big deal for a lot of people.
Right, right.
And there are a lot of I call them fad diets. There's
right.
a lot of diets out there. Are they good? Are they bad? Or how do you know?
It's really difficult today to know the difference because there's so much information that we're getting. We get it every time you pick your phone up. You're going to get some sort of nutrition advice. So that's kind of we battle that as dietitians on a daily basis. So really, you know, the best thing to do is make sure that you are you're receiving information from an accredited source, a really good source like American Heart Association is a good place to go for information. You know, as far as dietitians go, we do so much more than just the weight loss itself. Again, we look at everything about that person individually, so that if someone were just to pick up a diet and start following it, there can be some things that could potentially be a problem for them, for that person. So like if they're on medication, that could interfere with the type of diet that they're following, perhaps. You know, and there are some, you know, pretty strong information that kind of shows us that it helps to lose weight in some of these fad diets. So that's difficult to explain to someone that it's not always a good idea to do a quick weight loss and that type of thing.
So before you do a fad diet, a keto diet, or whatever kind of diet you want to do, you want to check with your dietitian, check with your doctor to make sure you're healthy to do that.
Exactly. If you're healthy enough to do that, you know, a little experimentation is okay. If you're young and you know, maybe you're into sports and you want to do the keto diet, it's not necessarily not recommended. It's just that everyone's different, and we really need to individualize these diet plans.
Okay, one thing I told you I was going to ask you real quick.
Okay.
Worst food, what is it?
The worst food, in my opinion, would be any kind of concentrated beverage that has sugar in it. So mainly sodas. That would probably be the biggest. So and also it would probably have the biggest impact to cut that out of your diet if that's something that you're doing on a regular basis.
That's great information. Thanks for coming in and sharing.
Thank you.